Hey guys, welcome back to Coaching Coins YouTube channel. For those that are new to us, welcome. I hope this will be helpful to you, and if you have other requests, please let me know, because I want this to be helpful and resourceful to you as much as I can. For today, I'm going to go over some interviewing pearls. I think most of the students, or in general interviewees, know the typical questions, so I'm not going to go over them a lot, but I will go over a few, and then just some pearls that I feel like I've noticed students have done in the past, and how they can improve and vice versa. So with that, we're gonna go ahead and get going with that. So just really quickly, in terms of the types of questions you should expect for residency interviews for PGY1 or PGY2. The questions will be a little bit different, but very similar in terms of situational based or behavioral. They want to see how you are overall, and by doing that, by looking at your past decisions, help them predict the future. At least that's the best indicators that we have right now to really looking at how you'll be doing and performing in the program. So really think, as you go through rotations right now, especially when you're in clinical rotations, what I recommend to my mentees and students is to document, do a little journal on your significant interventions, both things that you recommend and got accepted by providers, or recommend and didn't get accepted, or there was a conflict that you had helped to resolve. Overall just major interventions that you felt like, oh, this is good to tell them and a good story. And you want to tell them in a STAR method. So they'll ask you questions, and then you want to use the STAR method. And what is a STAR method? It's situation. So you want to describe a situation. So for example, when I was on my critical care rotation, I had to make XYZ intervention because the patient So that's situation and task. And then A stands for action. What did you do to resolve it? So not knowing this information, I had to look at primary literature because it's ambiguous in the guideline, etc., etc. Just kind of talking about your critical thinking skills. And then R stands for results. So what happened at the end? The physician agreed with my recommendations when I show him this primary literature for this patient that we haven't seen in terms of the complexity, etc. And then kind of wrap up and close the loop for the interviewers, just so they can kind of piece things together. So using a STAR method, you can use it for a lot of different questions, and mostly for behavioral, like state the situation, task at hand, what is your action that you did, and what are the results at the end. You can also use it for strength and weakness question. It's just really how you phrase it. Overall, you want to keep the do's, keep your answers concise, to the point, and direct. If you're not sure of the questions, write or clarify the question before you just ramble on. Every question should be no more than 2 to 5 minutes. It depends on the questions. 5 minutes might be too long, but again, 2 to 3 minutes is a good time to respond to a question. And then of course, be ready to discuss the strength and weakness question. There's probably thousands of ways how they're going to ask that question, but just be able to think of 3 strengths and 3 weaknesses. And the other typicals are, then why us, why this residency, what are your career goals, what are your expectation of residency, just overall, are there any potential conflicts, etc. In terms of schedule conflicts, which most likely not. Those are like the typical questions. And then career plans, and at the very end, they're gonna ask you, well, what questions do you have for us, or do you have any questions? And you have to say yes. Even you have to ask one question, please ask a question. And the reason why, because it shows that you did your research and you're also interested, engaged in asking them questions. Most of the candidates say, nope, I'm good, I know everything. Well, there's stuff on their websites that you know, but there's stuff that you don't know. So these are custom questions I'm going to give you as heads up. And Oh, big shout out to my mentee, Ashley. She was the one that actually proposed for me to do this video, because she's like, you know, I have never done a residency. I'm not sure what question to ask the residents. Hence, this is the video for her and for the rest of you who feel this might be benefit than you. Okay, so what are some questions to ask that you may not see online? And the do's is ask questions that is not obvious. Things that you can search online or talk to people about, you know, do those research all in the back. Like, you should know all that by now. I'm gonna tell you some questions that you should ask so it shows that you're engaged and involved. First, what is the culture like for the pharmacist? I saw that you have this rotation, you know, like a special rotation like transplant and pediatrics, or pharmacogenomics. Some rotations are just off the wall or not the normal. Just kind of ask about, describe the day-to-day functions, or what are some, or how do residents get involved in that, even though your knowledge may be not up to par. What do the residents do together in their free time? What changes have you seen or expect to in the next year or two? Because that might affect you, like if there are leadership changes or if they're opening new positions, things like that. That might be a job opportunity. So start thinking about visionary, and it's always good to ask those questions because it helps them to know that you start planning and thinking ahead. And it's also good for you because you kind of know, oh wow, we're expanding, so there might be a position for me after I finish. Can also ask about what are some policies or clinical algorithms that pharmacy owned, and what are some programs, clinical programs that we're about to expand. I mean, it depends on the program and depend on your background research, but these are some questions that you may ask during the interview. What do you like or dislike about the city? What are some residents' research projects in the past that got presented or published? Or how do the research projects get vetted? I have a few questions here, so that's why I'm looking at my screen. If there are PGY2s in the program, what is the interaction like between the PGY1 and PGY2? And I will also ask about staffing. I know that's probably the last thing on your mind, but you definitely want to ask because it's quality of life. If you work every other weekend, it is brutal, but it's doable. Most of the programs, you know, I wouldn't say most, but I would say quite a number do have every other, every third, every fourth. Just really depends. And if you're PGY2 and PGY1, ask. Most of the time PGY1 do more staffing component, PGY2 do more clinical. So just kind of ask about what is the support structure like when you're starting to staff? Are you expect to fly solo after a month, or is there a training programs that you go through first for 3 months or 2 months, or during orientation before you start to staff? What would that floor or units be like? If you have a special interest in transitions of care or neuroscience, you know, whatever, let's just ask them what types of environment you'd be in and what is the supporting structure. Will you be having a pharmacist with you for the first couple of months before you fly solo, etc. And then there will be time for you to spend with the residents, and these are questions for only when you're with the residents. Just ask them openly, and most residents would tell you candidly about the program. Like, do you feel like you're in a supportive environment? If you had an opportunity, would you do the program or choose the program again? What are the strengths as well opportunities to improve in the program? Those are really, I would say, some core questions that you have to ask them. And then in terms of with that question about supportive environment, they'll start telling you about preceptors. And you can, in the big group setting, you can ask about how often you get feedback sessions with the preceptor. Of course, with a credit program, you have ResiTrack that does midpoint and final, but you can also ask about how feedback structure would be. Let's see. I think that's really the majority of the things I want to share with you in terms of interviews as well as question to ask. I know there are a lot more, but I just want to cover some core. And then, oh, before I forget, quality of life questions. I already mentioned about staffing, how often you can staff. Parking, is it free or you have to pay for it? Because, you know, as a resident, your salary max at 60,000 or lower, 50 or 45, depending on the program. So is that something you have to pay for, or is there a parking that you take a shuttle bus to? Quality of life stuff. What are some conferences that you have to, or not have to, but conferences that they're willing to let you go and pay for? If you are an admin residency, they most likely do leadership and mid-year. If you're strictly in the PGR1, you may just have mid-year. If you want to go to additional meetings, how would that be supported? Those are the majority of the questions I think that will give you greater clarity to the program overall and just give you comfort. And the last thing is trust your gut. I know when people told me like, trust my gut, what does that mean? It really is go by the feelings that you have when you interact with everybody. Do you have a sense of community? Do you feel like you fit in? Do you feel like the team you'll be able to work with really well 1 year or 2 years? And then kind of trust your gut. Go with what your gut is telling you. And really important, after each interview, I would do a quick journaling on reflections, like the pros, the cons, the things that you like objectively, but also emotionally, versus just so you can kind of capture that. Because as you go through, after like 2 or 3 interviews, you're gonna start merging things together. And when the ranking time comes, it gets really hard. So definitely take some time to do some journaling, reflections on your experience. I would recommend if you're traveling back on airplane, you know, do it right away, or when you go back to your hotel, do the quick journaling really quick, pros, cons, what I like, what I don't like, my gut tells me blank. Okay, I am done. I think that's all that I have, and if I have more, I will put additional down in the comments. For those that are watching these videos and you have other grateful insight, please put it for and share with others. And to reward for those that are watching till the end, if you want to send me an email, I am happy to answer any questions you have. Is pangrx@gmail.com, and the code word is empower. So if you put the empower as the subject line and send me an email, I'm happy to set one-on-one discussion with you, and I'll do it for the first 3 people that email me. Congratulations to get to the end, and best of luck on your interview.